some technical issues to get Secretary Scrase on the line, so we'll get started in just 1 minute. Thank you.
Can you hear me okay?
I can hear you okay.
Great.
All right, Dave, we've started the broadcast. Apologize everyone for the delay and start time. We were working on some technical issues. Dave, I'll just say a few opening remarks and then turn it over to you.
Great.
Hi, everyone. Thanks for joining us for this COVID-19 Day 101 update. This is a webinar presentation for members of the media, and we're excited to, hear your questions and answer them to the best of our ability today. We're going to try a different format because based on the feedback that we received from you all last time, I'm going to do the best I can to allow you all to ask your own questions to David directly. I think to help facilitate that and to make it easier, we're going to follow the same format where we'll have different topic areas. If you have a question related to the topic that David's talking about, if you could let me know by sending a message in the chat or raising your hand, I'll queue you up to ask that question, and then we'll have a general question and answer period at the end of David's presentation. We will send this presentation as well as a link to the webinar, to the recording of this webinar after the broadcast. So I think with that, David, I'll turn it to you.
Great. Thank you so much, Alex. I'm delighted to be here again today. Thanks for your interest in these science-based updates. I think the technical difficulty that caused us to start 2 minutes late was me clicking on the wrong calendar item. So just wanted to own up to that. We're going to go through a whole bunch of topics today, talk a little bit about just the usual update on our data and statistics at the beginning with cases. I'm going to give you a couple updates from the medical advisory team that will have some interest to you and also to your readers. A science update highlighting some articles. And on that section, I'm not going to go into great depth, but we will make this presentation available to you, as Alex said, and you can just, if you put it in presentation mode, you can click on the title of each slide. It'll take you right to the scientific article. We'll go in a little bit more detail on gating criteria today because we have changed the way we calculate spread rate. I wanted you to know about that. But in each of these 4 sections, I'll stop, Alex will field questions with you, and then we'll go back, and then of course we'll have the rest of the time at the end for general questions. Last, just so you know, if it doesn't work out to do the audio questions, I don't see what you're typing up into the box. if you have to submit them in writing. So it's just as big a surprise to me as it would be if you just asked it outright. So let's just wade right in, go through our update first. You're used to seeing this slide from me. I'm going to start on the right with the running total of cases. And you can see, I'll just sort of outline what I think what I see when it squints. One thing you'll notice is this weekend pattern of lower cases, which of course has nothing to do with the virus. It's just testing and reporting and how labs run things, but sort of a general curve that looks like this with a second wave. And I'll show you that again, primarily in Otero County, but we'll go through that. And then testing, we're over 250,000 tests, which is enormous. We've tested more than 10% of our population. I think we're still in the top 2 or 3 states in the country in terms of our testing. And in some ways, one thing we're seeing actually is a little less interest among the general public public being tested, because people feel that perhaps maybe things are getting better. And we'll talk a lot about whether or not things are getting better in a bit. Our heat maps here show the total number of cases, still highest in McKinley and San Juan, although thankfully we're seeing a drop off in the total number of cases, which is just great. This was as of 6/17, so a couple days old. And you can see just the prevalence rate, like how likely you are if you live in a county to get a COVID infection. And very similar to the map here, although Bernalillo isn't quite as prominent given the number of people that live in Bernalillo County.
Hey, David, we've got a request if you're able to turn your webcam on during your presentation. If that's too difficult, don't worry about it. But
sure. Give me a second. We're in go to meeting, right? I only have one screen right now, so let me share my webcam. Did that work?
Oh, yep, I can see you. Yeah, nice tie.
Thanks. Okay. Thanks for jumping in there, Alex. So usual data, I was just going to talk about hospitalizations. Hospitalizations generally are a function of the number of cases. A certain percent of people that we identify as having COVID, somewhere around 12 or 13% will be hospitalized. And you can see that a certain percent of people who are hospitalized will be on ventilators. It kind of went up to the 30 to 40% range in early June when we had the early in the peak in Otero County, but now is coming back down again. And so it's about that typical 1/3 of all patients, exactly 1/3, if you do the math, of people in the hospital will end up being on a ventilator because of the severity of the effects of the virus on the human pulmonary system. My favorite graph for a variety of reasons. Number one, you'll see it's a 7-day average. And so 7-day averages are much better for looking at what's happening in the state because it smooths out all that day-to-day and weekday to weekend variation and gives you a good sense of what's happening. We all rode this curve together, thought we were at our peak, started to come back down. This was initially driven by Bernalillo County in the center of the state, and then subsequently driven by the northwest corner of the state. But we have been seeing nice declines, and then the southwest, which houses Otero County, in the detention center and the federal facilities there, caused another spike. But in general, you could, if you squint, you can kind of see a general downward trend coming like this that we certainly hope will continue. We'll talk about this a little bit more when we get to spread rate near the end. Another measure, I think you all know that we were using doubling time. Doubling time is a great measure to use when cases are going up, but not as helpful when they're going down because you would kind of eventually get to an infinity doubling time, so not very useful. So now we're looking at a 7-day average of the daily growth rate of cases by collection date. Now keep in mind that COVID unrestrained has a growth rate of about 24%, as high as 24% per day. So being at 1/10 of that, even when it was higher in mid-May, we're coming down now and we're at about 1.2%. Ultimately, when when we go below, when cases really start going down and spread rate really persistently stays down, this will turn into a negative number, which would be relevant for growth rate. And you can see these curves a little choppier than we're used to, more up and down, but they are smooth by the 7-day average. And so we're continuing to look at growth rate in addition to spread rate, and not so much really looking at doubling time anymore. I dropped that a few weeks ago for my presentations and no one complained. So I'm just going to assume we're all good with that. Miles traveled in New Mexico continues to have this slow I'm having an electronic voice say unmuted to me. Is that something I should worry about?
No, don't worry. You were somehow muted, but I changed it back. Go ahead.
Okay, thanks. The mean miles traveled for the whole state continues to slowly creep up. And again, I'll get to more of this later, but it does worry us. And our work with Los Alamos Lab, which has just been spectacular lately, has really shown us that there's a very strong correlation between mobility and spread of infection. So we watch this closely, but this is interesting. This next slide, some new data on mobility from regions of the state. And so what you can see here is that the Southwest and the metro region have started low, dropped substantially low. They're coming back up, but they're actually the lowest in the state. You can see that the green, the Southeast, and the orange, the Northwest, started higher in terms of miles traveled. More rural areas, that might make sense, drop down and coming up in parallel. And then the one that to keep an eye on is the Northeast, which all of a sudden it was high, dropped quite low, and is sort of catching back up to its starting level as well. So we want to watch those. It does help. Los Alamos has adopted the method we use in New Mexico for the math on the distance traveled. They think it's very effective, and they do show a strong correlation with cases. This is a new topic, so I'm going to take a few minutes to go through it with you. One of the things that the governor really took an interest on very early on and has been really driving more recently is that we pay really close attention to high-risk populations. And we've talked about this for quite some time. Nursing home residents and staff, assisted living residents and staff, essential workers like food handlers, utility workers, healthcare workers fit in there too. Those immigrants, refugees, and asylees, we've had some outbreaks. Native Americans, of course, we know that that's a big issue in terms of the rate of COVID infection, mainly related to multi-generational family homes. People who are incarcerated, we've recently seen that. Certain youth populations, like in CYFD facilities and other locations, child care centers also, and under-tested counties. And so I want to turn your attention here that if you divide the total New Mexico population is this line, that if you divide it into high-risk and non-high-risk populations, you immediately get close to what we call the 2080 rule, where 20% of the people or items seem to be related to 80% of the problem. In this case, it's people, and you can see that this high-risk population is about 17.3% of our total population, and has had only about 15% of tests, of all COVID tests done to date, but has had 77% of the positive tests. And another way of looking at that is that if you're, whereas the rest of the population has had, 85% of the tests, but only 1% of the positive tests. And I think we've done some math on this, and you can sort of see it in the positivity rate. Your likelihood of having COVID, if you're in one of these high-risk populations, is dramatically higher than if you're not in one of those. And so that's something we're looking at even more closely, reporting on more regularly, and developing testing strategies to ensure that we have those higher risk populations covered, and we're monitoring what's going on there. You'll probably hear more about this, and maybe I can feature data from different populations in the coming weeks, but it's really interesting to see the fact. I mean, it's just fascinating to see that you know, such a high percent, over 3/4 of the disease in our state is occurring in populations that are less than 20% of the whole state population. So why don't I stop there and see if there are any questions on the regular data. I can also scroll back up to slides if you have specific questions.
David, no questions have come in yet, and we can wait a moment or two to see if folks chime in or raise their hands, but so far no question.
Okay, well I'll keep going, but if somebody comes in with something,
we do have someone that has a question. Just a minute. And so Matthew Reichbach, I'm gonna unmute you. If you could state your affiliation before asking your question to David, that would be great. Thank you. You should be able to speak.
Matthew Reichbach with New Mexico Political Report. I was just wondering about how many people are held at the Otero County Processing Center, and how many of them have been tested, if you have that numbers available.
Yeah, I don't know the exact number at the detention center. I am under the impression, though, that 100% of people have been tested. And so if we can, Alex would know who to ask about that. I think we actually even have some slides that have those numbers, Alex, and if you can look up the total number, that would be great. But it was part of the process in controlling an outbreak in a contained facility, particularly when there's intermingling of groups and movement, is to do full testing. And I know for a fact that all of those counties, all 3 facilities in Otero County have had 100% testing. At least I was told. So anything else, Alex?
No other questions right now, David.
All right, and will you look up that number of folks in that facility? Do we have that, do you know?
Let me look at it now. I'll try and find that.
All right, thanks. Okay, so a little bit of science. This one particularly interesting to your readers is, so what happens to me after I get COVID? When do I go back to work? I think probably in the top 3 questions I get asked repeatedly is, what's the definition of a recovered case, and why do we have still so many people who aren't listed as recovered? So let me start with that. First, once people feel better, they kind of lose interest in returning DOH phone calls. And so some people drop off, and we only certify people as recovered if we can talk to them and say that they meet these criteria. And so the biggest part of the gap between total cases and recovered cases is not the people in the hospital, it's people that just didn't complete the follow-up process. But so let's say you're at work, you're diagnosed with COVID, you get called by the Department of Health, and you need to remain isolated at home until you're told by the DOH that can be ended. They'll also call you and want to know every single person you've been in contact with, from when you got from about 48 hours before you got symptoms till now, if you're symptomatic. And so we'll talk about that in a little bit. The one thing is, a lot of employers are requiring negative tests, and that can be problematic. And let me explain why that is because in general, the clinical criteria for return to work are more reliable than a follow-up test, because when you have a COVID infection, the initial testing, all the testing with nasal swabs and nasopharyngeal swabs test for viral RNA. You can still have viral RNA in your nose, and I think the record is over 60 days, that is just remnants, sort of the leftover byproducts of a killed off COVID infection, but it can last for quite some time. And so the test will pick that up. It isn't a test for live virus, it's a test just for the RNA. And so it's really rare for people to be infectious longer than 9 days after the onset of symptoms. And so a symptom-free period is just as reliable as a negative test, and in some cases more reliable. So let's go back to you being isolated at home, you would be considered recovered after you talk to the DOH, and please return their calls, at least 10 days after 10 days have passed since you first got symptoms, and you haven't had a fever at all for the past 3 days, and you feel your symptoms are substantially improved. They may not even be resolved, but if it's been 10 days since you started having a fever and a cough, and you haven't had a fever in the past 3 days and you're feeling better, you are actually safe to go back to a work environment with all the COVID safe practices we've talked about. If you never had symptoms, and I'll talk a little bit more about this in a little bit, if you've never had symptoms, you just have to stay at home for 10 days since you had the positive test result. So that's how that works. We've gotten questions on remdesivir. We have an elaborate system set up through the MAD and through the Department of Health Operations Center. We've received 3,109 vials of remdesivir. We review this every day. It's enough treatment for somewhere between 300 and 450 people, as you can see there. We do post the information about how we distribute it. And the reason we're so intent, there's two reasons. Number one is it works. In a study, actually very good study in the New England Journal of Medicine, a randomized study showed that the group that got remdesivir in the intensive care unit had a recovery after 11 days compared to 15 days for those who did not. So a 4-day improvement there. But even more importantly, there's almost a 5 percentage point or 1/3 reduction in mortality rate for those who get remdesivir. So number one, it works. Number two, if we are really responsible in making sure that every patient in an intensive care unit who's ill, critically ill, gets the remdesivir, then that increases the amount that we can continue to get from the federal government. And so we have a distribution system set up. That's going very, very well. You know, at any given point in time, we may have completed only 50% of the courses because, well, one, a bunch of people are getting the courses of treatment and haven't finished. And number two, you know, we just got a big new shipment in and the shipments have been getting larger. So we're really happy. I think New Mexico is doing a great job with getting this potentially life-saving drug to people. And the system that's in place for reporting on it and using it is working well. Hats off to Chris Emery, who's really driven this process over at DOH and runs the command center for really keeping that front and center for all of us. Next one that you may or may not know much about, but I think in late March or maybe early April, we did contract with Battelle, which is a national firm that provides basically the trailer that goes on the back of a truck, a container, and inside it, there's a system where it decontaminates thousands of N95 respirators using concentrated hydrogen peroxide. And so you can reuse these masks several times, which is really important because PPE, if you all remember, in March was our most critical resource and is something that really is critical for keeping hospital employees safe. And so in any case, we have 288 healthcare facilities in New Mexico that have this agreement with Battelle. We've decontaminated 9134 masks, and we're actually moving up. We're 16th in the US for using this, but actually 2 days ago, we were the highest city in America for mask decontamination. So we're on a roll here, and we wanna, as you know, PPE supply for hospitals is a gating criteria. So it's really important to us that we use every possible resource to get as much PPE as we can available for healthcare providers. This is the most critical resource, and we're ramping up. We continue to ramp up its use. Kudos to Presbyterian Healthcare Services, who's the #1 recycler of PPE masks, and was in large part drove this, our #1 ranking a few days ago in the country. So that's a little bit on MAD activities. I'll pause again.
Yeah, hi, David. No specific questions about the MAT activities, but another follow-up question about the Otero County facility.
Sure.
Well, the question is, does the 100% testing at Otero include both state and federal inmates?
Yeah, that's a great question, and that one I'm going to have to look up and get back to you. Most of the data I see is state data, and I should have highlighted that earlier. So that's one. Why don't we take down that person's name, and we can actually even put a slide in the presentation we post online with the date, whatever data we can get a hold of.
Okay. I did find some testing data around the Otero County Correctional Facility that I can share. To date, the total number of COVID-19 tests that the New Mexico Corrections Department is reporting, and so this would be for state correctional facilities across the state, is 3,699. And the week of June 8th through June 14th, they tested 1,320 individuals.
Okay, we'll continue to look for that Otero County specific data as well.
Okay.
All right. Let me go on to a few key science articles. I think part of my role is really to highlight where things are controversial or uncertain, and also to highlight things that have been controversial and uncertain, but now there's a lot more data. So let me do a little bit of that. I think one thing to just mention, and I know I mentioned this before, but I can't tell you what a pleasure it is to actually work for a governor as sort of a scientist myself and a physician who says things in the media like, we're going to demand in New Mexico that science guide every decision we make. And, she really, every day that I talk to her, is really focused on this, focused on making sure we have evidence. And I think as we start looking through some of the other slides you'll see later, I want you to reflect on the role that science-based and evidence-based decision-making has made in New Mexico and the lives it's saved. Also, I've been a huge fan of Rolling Stone magazine. It was always my dream to be on the cover, but I've abandoned that, but it's great to see my boss there. Here's an interesting article, and it studies all the different reasons why people might or might not comply with COVID-safe practices or public health recommendations. And, we think of their political persuasion or religious background or conspiracy theories or, as these drivers of these things. And what the folks who did this article ultimately found was that really it's fundamental, even more fundamental than political or religious ideology, is whether you have a basic trust in science or not. And if you have a basic trust in science, you're way more likely to keep your 6 feet of distance or wear the mask or do those things that are really required in order to keep spread down. And I just found that was fascinating. Of course, being a scientist myself, I think it's just great, but it is really interesting, and also sort of helps us understand in state government how much and how important it is to really explain the science the best we can and provide people with references. You'll see some pictures on the right here in the next few slides of the articles that we read and use, and I'm going to recognize some folks at the university at the end who really helped us stay in touch with the science behind this. Here's another one. This is an international study, and where they found that they actually looked at 172 different studies and said that keeping 39 inches apart and wearing face masks and eye protection are the best ways to cut the risk of COVID-19 infection. And they also, for our 6 foot distancing, say that if you go to 2 meters, which is 6 feet 6 inches, you can reduce interperson transmission by another 50% above what you get there. And so I think there's really no question now that masks help. I hope we can take that one off the table. I hope that folks won't consider their choice to wear a mask or not to wear a mask to be a political expression of solidarity, but rather that people will choose to wear a mask because we believe it works. And it's my way when I wear my mask of keeping you safe when I'm out in public. Also, I want to do a commercial. My family and I took a hike in the Sandias this weekend, and there's some confusion about mask wearing outdoors. I think if you don't read the public health order carefully, you might think that if you're exercising, you don't need to wear a mask. And it says that in part, but it says if you're exercising, you don't have to wear a mask as long as you stay 6 feet away from people. If you're within 6 feet, you have to wear a mask. And we were wearing our mask. I was taking it on and off as people came by down the trail, but it just got easier to leave it on. But I will say that about 90% of people coming down the trail were not wearing a mask. And I think it was this belief that if I'm exercising, I don't need to. If you've been up the Pinot Trail, you know it's not 7 feet wide all the way up. And so just a reminder that even with exercise, you're only free of that requirement for wearing a mask if you're more than 6 feet away from people. There's further evidence that shutdowns really are working. You can see over 60 million lives saved, infections prevented, 60 million infections prevented, which would be somewhere between 60 and 240,000 lives saved. You can see very larger numbers in China, but all across the world, huge reductions in infection rates through the shutdowns. I know they've been inconvenient and frustrating, but at least from the health side of things, there's clearly a benefit, and clearly they've reduced the number of cases by keeping people from interacting and spreading the virus to each other. And then a real controversial one, and I want to take a minute on this one as well. Unfortunately, the leader of the medical effort for the World Health Organization stated in a press conference that their asymptomatic transmission was minimal. And I think the scientific community kind of went berserk. She was inundated with articles that show this isn't true. I thought you all would be interested to know that in New Mexico, according to DOH data, about 24% of the positive test cases had no symptoms. And so we're finding actually through the testing strategy that we're using, 1/3 more cases than we would have if we had stuck with only testing asymptomatic people. So anyway, they walked that back. They apologized. They came back and said, well, there may be some asymptomatic spread after all. There's really clear evidence that there is in multiple studies. So I have no idea what that was about or why that happened, but I wanted to make sure you were all clear on this. And I thought you would find it really interesting that 1/4 of our cases here in New Mexico have no symptoms. Anything on those science update topics before we go to gating criteria?
No, there are no questions.
Okay, we can keep going. So if you look at this closely, you'll notice that our initial value used to be 1.15 and we've lowered it to 1.05. It's because we made a change in the rate of spread calculation that I'll go into detail on. And I'll explain in just a minute when we get to the graphs. But the good news is we're below 1. And so what that 0.93 means is for every 100 people now who get a COVID infection, only 93 will be infected by those 100 people. And if you do the math on that and take that out over a few cycles, you see that absent any other changes, we would have 0.93 times 0.93 times 0.93 becomes a progressively smaller number. Testing still shooting for the governors 5,000 a day. We're at 4,185. Other articles would suggest we need to be doing at least 3,300 tests a day. So we've been well over that for a long period of time. Contact tracing and isolation, working to get folks contacted within 24 hours. However, when we get the result of a positive case, we're running at 26, very close, and then contacting their contacts, anyone that a case is contacted within 12 hours after that, and we're at 33. So we're real close, and the state is hiring new people each week to be contact tracers, upping the real real dedication we have to this effort and trying to get people earlier and earlier. Not everybody answers their phone, and we're looking at implementing electronic means to contact people more quickly. Delivery system capacity, I'll talk about a little bit more when I talk about Arizona, but we're at 276 ICU beds full today. We have 230 at baseline, so that's 46 more than normal, but we are continuing to provide services in those hospitals that have flexed up and taken over other parts of their hospitals to turn into ICU beds, operating rooms, or catheterization labs, or GI labs. And we're good with PPE as well. So in general, we're, overall very close. And taken as a whole, I think we're at a place where the reopening that we did on June 1st does not appear to have overwhelmed our system or taken us beyond where we wanted to go. If you're watching my favorite, what was my favorite website last week, where New Mexico was green until we turned red, you know that we turned red due to the Otero County outbreak. We had an uptick in cases rather than a downtrend. I think it was yesterday we turned green again. You can see what they track here. You can go to the website again. You can click on this link and it will take you right to the website. Interesting, a little bit more widespread variation or spread in the variation on the rate of spread. The state overall 0.93, and that's really been pulled down by the rapid decline in daily number of cases in the Northwest. And maybe now I should talk about how we changed the measure. Just as doubling time, if you remember a long time ago, we added, instead of making it the last 7 days, last N days, we increased it to the whole length of COVID. With rate of spread, we were not inputting daily case rates. We were putting in daily case. Every day we would put in the total number of cases in the state, which provided a buffer that stabilized it. But then we realized once you get over the peak and you're on the way back down, you wanted to more adequately show what our progress was. And so we've gone to a method where each day into the model, we just enter the number of cases that we were reporting for that day. And actually, we constantly update the number of tests that we'd use the test date. So if you had a test 2 days ago and you got the results today and DOH got the results today, your case would be in the 2 day ago group, if that makes sense. The other thing that we noticed, and I'm going to go through each one of these regions in a little more detail, is that across the whole state, our benchmark used to be here, but across the whole state, we were running a little bit below the 1.05, looking back in retrospect with a new method, then dipped up again, and now we're below. So this is all of New Mexico. And G. Wang, our outstanding data analyst at HSD, has provided you with a visual comparison of the spread rate and the number of cases. So the spread rate's higher when the cases are going up. This just goes back to late March, so right about to here. And then you can see as the cases are coming down on this dotted line, which is the 7-day rolling average. And just a reminder that we're not supposed to look in this gray area, but it's impossible to resist looking because we might not have complete case counts just yet from lab results that haven't been back. Here's another look at the exact same data, but in this case, red is Otero County taken out. The detention facilities are the red ones. And so a little bit difference in the curve here. And now we're going to go to the regions of the state. Metro region actually coming back up a little bit, and today a little bit higher, but you can see the case counts here as well with those big weekend dips. Northeast region, and I should have said this earlier, so let me go back. Maybe I can't go back. Let's see. Notice that the axis here is very different. So, all of New Mexico, we have case counts going up to 250, and then that one day when we had 330. And as you get to some of the smaller counties, metro region even, sort of peaks at about 75. Northeast region peaks at about 12. And so the regions with less cases actually contribute less to the overall spread rate. Northwest region, very high, and so all the way up to 180. And so when that came down, that really pulled the state case counts down as well. Southeast, again, small number of cases, maximum 14. So good progress there. And there were hardly any cases. So this new way of measuring is more sensitive to individual numbers of cases. And we really have to look at it over a 10-day average to make sense of the data. Southwest region here, you can see with the 7-day lag how that works. And again, bigger numbers. This is with Otero County, and I think the next one is without, with them separated. So, you know, I think there's this general belief out in amongst the people in New Mexico that things are getting better and now we can all get back to work. And the thing that emphasizes the reason things are getting better is not because anything has changed about the virus, it's because we are doing more social distancing, we're wearing masks, we're keeping apart. And so the virus is going to be the same, and we're going to be just as susceptible to it until we're all vaccinated, or a large percentage of us are vaccinated. Remember that, please. And tell your readers that as well. This is, you know, the part that makes all of this better is what people are doing. The part that keeps all of this better is them, our New Mexico folks continuing to do what they're doing and not relaxing. And on that note, I wanted to just talk a little bit about what's happening with some of our neighbors. You can see that New Mexico has the highest rate of people over 65 that are at risk adults. New Mexico also has slightly the highest percentage, sorry, I said percentage of folks under age 65 that are at risk. And so that's an issue for us. It's not that much different, but then our ICU beds per 100,000 are the lowest in the country, and that's a big issue for us as well. I think in retrospect that should be 10,000. Yeah, that's what it says. So it's per 10,000. So ignore this title. We'll correct that. And that makes us vulnerable and more easily kind of susceptible to an outbreak or a high number of cases where people end up being hospitalized, particularly high-risk individuals. Let's look at Arizona for a minute. They began easing their restrictions right here on 5/15. Over the past 7 days, they've had almost 1,600 cases on average per day, new cases a day. Since Memorial Day, cases have more than doubled, which Memorial Day would have been right around in here. And before they lifted their stay-at-home order, you know, to the left of this, only 5% of their COVID tests are positive. And on June 16th, just a few days ago, 16% were positive. So they're clearly under testing now, and this rise in cases is in all likelihood underestimated as well. So the problem is likely even worse than it would appear to be. And it's really, really bad. And now Arizona's reconsidering this decision to end their stay-at-home order. Texas, hard to believe, one of the first states relaxed their stay-at-home order at the end of April. And since that time, cases have more than doubled. They got 2,400 average new cases per day over the past 7 days. And they've doubled their number of people in hospitals as well. And so this is really a serious issue. This relaxation is just what happens when you relax without accelerating or substantially increasing your preventive and self-protective and protecting other people measures is completely and totally predictable. And the virus is the same. People are easily infected without masks, and so we have to remain cautious. You know, there's I just was going to say just a little bit about this today, but we are also looking at how we reopen schools safely. We're looking very closely at what's happening in Europe. There's some early data out of Denmark and also Iceland that are promising with respect to the fact that children may not transmit COVID as much as adults do. We already know, of course, that they're not as severely affected by it, but the real issue about reopening schools is whether they're transmitters and whether they can spread at schools. So I know Secretary Stewart is working really hard on that. We've all worked very hard on that this week to figure out when, how, what method. We're seriously hoping and praying that we get more data from other countries soon, because I think that will help us even more. But this is a big focus because obviously we've got 330,000 children in New Mexico that this will affect, and we want to do it right. And we don't want to just do a dramatic reopening of schools like other states have done with their stay-at-home orders, because we know that if we did that, we would likely see a huge uptick in cases. And so I did want to take a couple minutes to thank a few people that have done a huge amount, and then we'll go to general questions for the rest of the time, and it looks like we have plenty of time for those. Dr. Mike Richards, a colleague of mine for many, many years, really joined me in starting up the medical advisory team, pulled together the statewide delivery system, the call center, the hub hospitals, the medical group that's been providing all of our information about medical issues, the nursing home group, the transportation group, the modeling team. Mike really brought all of this up and running. And today is his official last day on the mat. As you know, Dr. Roth is retiring from his 30-plus year role as chancellor of UNM, and Michael needs to really work side by side with Dr. Roth for the next 6 weeks until Dr. Roth officially retires. And so he's just been invaluable. I encourage all of you to go out and write a human interest story about Dr. Richards. He's an amazing man. He has a huge background in emergency management, has worked for the Department of Health in the past. And I know he will be available to me. He's just a phone call away, but we're really going to miss him. And we're working to go into maintenance mode on the medical advisory team from now. You know, I think we're done our initial response to the crisis, but now we're also going to go into maintenance mode as we get from here to a vaccinated status for our population. And then second is I wanted to thank all the folks, especially Christoph Lambert. I asked him if he could send me the names of his folks, and I got this very beautiful 15-slide PowerPoint presentation with pictures and everything. We don't really have time to insert that entire thing into this, but there are 68 people that have combed through all of the medical literature that's produced by this computer program that combs through the medical literature and really presented to the medical advisory team, to myself, to healthcare leaders all over the state, those key articles that are most worth reviewing. And so I encourage you to, we still get those briefings every Sunday, Tuesday, and Thursday. Got one last night. The science slides I show you every time are directly taken from that. But you can also go online at UNM and access all of the briefings. They're a great gateway and a research portal for you if you want to find everything important that's been written about masks or remdesivir or even reopening strategies. You can find them there. So thank you so much, Dr. Mike Richards. Thank you so much, Christoph Lambert and your team, for all you've done to support New Mexico in this crisis phase of this pandemic, and for all that you're going to continue to do in your roles across the state as well. And I think, other than just showing you the usual healthcare worker and first responder support line, I think we have the rest of our time for questions. And I'm going to close this presentation and I think go on camera now full time. And Alex, do you want to stop my sharing or should I?
Let me see if you're able to, David. Yes,
I think
I no longer see your screen, so it's just you on the webcam.
Great. So what can we answer for you? And like usual, we don't know everything. So if you have a question that we can't answer, we'll write it down, we'll research it, we'll get back to you.
Okay, so I'm going to ask a question on behalf of Jaden Torres, who he tells me that his microphone is not working. So can you ask Dr. Scrase what the next steps for reopening further are? When can New Mexico expect other things to slowly reopen?
Great question. The subject of like 100 emails a day that I get. I think that if you think about the gating criteria, what we're really trying to do is reinstitute in New Mexico all those things that we just can't go 18 months without. And those things include, you know, basic commerce, not advanced levels of commerce. They include schools, certainly. And we can't just take another year off from educating our kids. And, you know, you saw us gradually reopen businesses. And what we're trying to do, as that picture of the guy on the tightrope showed, he wasn't even standing, he was on one knee. What we're trying to do is gradually reopen on the one hand and increase the number of countermeasures that we take on the other, so that each step of the way, the people in New Mexico are doing more to prevent the spread of the virus as we have more contact with each other, which absent countermeasures is guaranteed. So I think we had a major setback. I think we were looking at reevaluating the phase 1 reopening and reassessing about phase 2 3 or 4 days ago, with the surge in cases and the fact that our ICU beds are more than 100% full. I think we decided to go another 2 weeks, basically. And so we're aiming for rethinking phase 2, which basically would be more reopening of businesses, or more than a 25% capacity, perhaps. That's what we're looking to figure out, how to do that. And then we're also looking at the medical literature and other sources to figure out, well, what are those countermeasures? What else do we have to do? I have a couple kids who live in California. We have lots of June birthdays. We've had a ton of Zoom meetings. And so I happen to know that in California, the distance requirement is 30 feet. That's a long way. I mean, that's clearly the other side of a 2-lane road from where you are. And so we're not thinking about that or necessarily proposing that, but we are looking for figuring out ways to reopen more. If I were to go one step further, I think that the most important countermeasure that we have in our pocket right here is getting everybody to wear masks and getting everyone to socially distance. I mean, there are so many examples, and you know, I get emails and people reporting people. You know, we don't really handle that, but there's so many examples of where we have opportunities to improve in New Mexico. And so I think if New Mexicans would like to see more things reopened and would like to get schools reopened and want to see more economic stimulus, then I would encourage you all to encourage your non-mask wearing friends to tell them this is about science, to let them know that it's a way that they can really advance and reopen the economy even more. And so it's, again, though, it's the watching the gating criteria closely. If the last phase worked and we're not seeing a huge uptick in cases, and we wouldn't count the Otero County uptick as a consequence of moving to phase 1 reopening. But if we can maintain a steady level and our ICU beds come down, then we're ready for the next phase. But you can be certain that we will be calling on you and all New Mexicans to go another extra mile in protecting yourself and protecting other people from spreading the virus.
Thanks, David. Now I'm going to invite 3 individuals to ask questions. I'm going to start with Matt Grubbs, then go to Ron Warwick, and then Julia Goldberg. And so, Matt, I'm going to unmute you in just a moment. You should be able to ask your questions, David.
Sounds good. Dr. Scrase, can you hear me?
Yes.
Wonderful. Hey, thanks for doing these. I really appreciate them and all the effort that goes into them. So thanks to you and your team for being available for this. Couple of questions, and they both oddly have something to do with Texas. As you were talking about masks, the big debate over in Texas, you've got mayors asking the state for the ability to create some sort of enforcement mechanism for masks. So more than just social pressure, more than just urging. I'm wondering how you feel about that. I know it's a policy question that might be more suited for the governor, so you can punt that one if you want to. But the other one is I live up in Santa Fe, and a lot of second homes, a lot of tourism around here, and a lot of Texas license plates, a lot of out-of-state license plates. I'm wondering if the numbers that you're seeing and the cases that you're seeing, things like pretty consistent results of 3, 4, 5 new cases for Santa Fe County, if that's reflective of an influx of population or visitors into New Mexico, into Santa Fe. Thanks.
So two really great questions. First one is on mask enforcement, and I'm very much a free market economist. I wouldn't be the head of HSD if I wasn't pretty socially liberal. But when it comes to the financial aspects of things, I do think that at least in this country, and a good part of the time, the market itself can be pretty effective. And I think the most effective way of mask enforcement is peer pressure. Obviously, we don't have if every person who wasn't wearing a mask was reported by someone else as not wearing a mask, number one, it would be, with response times, it'd be hard. That person probably wouldn't be in the same place, hard to track them down. But I think, if I go into a business and it doesn't feel safe, and I leave, or I stop with my mask on and talk to the managers, hopefully wearing a mask, and say, hey, I just want to let you know I'm leaving because I don't feel safe. There are too many people without masks, or whatever. I think it's California now that you have to wear your mask in the restaurant until your food is served. And so I would like all New Mexicans to put pressure on all the other New Mexicans to wear masks. And I think in the long run, that's more sustainable and more effective, and will end up being safer than putting a ton of resources into trying to enforce what really ends up being individuals not wearing masks. So if nobody got anywhere close to an individual wearing a mask, or is it? I think it might have been New Jersey, where they shouted the 8 mask-wearing individuals shouted the one non-mask-wearing individual out of the grocery store. I'm not suggesting that, but it seemed like it was effective from watching the video. I think we want to keep New Mexico safe. We want to keep everyone safe. So I'm more for us all gradually adopting that, and having folks feel uncomfortable in situations if they're not wearing masks, outside their home. In terms of the sort of steady uptick or not really uptick, but there's sort of a baseline level of cases in Santa Fe that we're watching. I'm not aware of any data that there's a higher number of Texas residents there. I know there are an awful lot of people that migrate in for the summer and leave, but I'm not aware of any kind of significant increase in cases. But it does give me an open door to talk about border states, because I forgot to say this earlier. There's an interesting paper in the Journal of the American Medical Association that shows what happened along the Illinois-Iowa border when one state implemented a stay-at-home order. And I think, and I might have this wrong, but I think Illinois implemented the stay-at-home order, and those border counties in Iowa saw a decrease in cases as well. And so there's no question that our border states, and if you remember that map where we're green and we're in a sea of red, that's a big concern. It's a big concern. And the more cases we have in Texas, or the more we have in Arizona, that's a problem for New Mexicans. We have an outbreak in Hidalgo County that's related to several graduation parties that were held across the border in New Mexico, where people brought back their graduation gifts and COVID. There was a baseball tournament in Arizona where we had a New Mexico team go, and coaches and players brought back COVID. And so it's absolutely essential that we be aware of the risks and thinking that this is over. I'm not sure how media people feel about the Onion, but if you Google phase 4, I think it is phase 4 city reopening, it's something about American City, it's Dallas, enters phase 4 of pretending that COVID is over. And it's a real issue. People, I think, really believe that the virus got really bad and now the virus is really better, rather than understanding that we got really good at cordoning off the virus and we have to stay really good. It's a completely different message. But no, I don't think there's a Texas contribution to the Santa Fe cases.
Thank you, David. So I will read Ron Warnick's question on his behalf. He tells me his microphone is not working, and he's with the Las Cruces Sun News. So the spread rates for the northeast and southeast parts of the state seem stubbornly high. Do you have any information on what's happening in those regions?
You know, I mentioned this really briefly, and without going through the trouble of bringing up the slides again, the Northeast and the Southeast are the places in the state where we have the least number of daily cases. And so the spread rates are they're really, the spread rates are driven by like percentage changes or upticks or downticks in the number of cases, relative increases and decreases, if you will, in cases. And so I'm not as worried about those new spread rate calculations in the Northeast and Southeast regions, just because I am looking at the slides myself, but I think the maximum number of cases looks like it's in the 10 to 14 range in the Northeast, and in the Southeast, it's around 14 as well. And so I think we're okay there. I think if it turned into the Northwest, where we had, thousands and thousands of cases, then that would be a big problem, and it would pull up the entire state spread rate. And so if that's one thing you'll notice, is those two regions are creeping up, state is staying low, is another way of saying that there are not a lot of cases there. But everything bears watching, and every time epidemiology sees that curve start to tilt up, that's an outbreak, and it's presumed an outbreak until proven otherwise.
Thanks, David. I'm going to unmute
Alex, before you go on to Julia, I wanted to recognize Julia and give her some sort of special Eagle Eye reporter reward, because she did contact us earlier in the week and said, hey, the spread rate just dropped suddenly. What's going on? So that's the kind of thing science sort of math guy really loves, is when we get those kind of questions. So with that introduction, Julia, what can I do for you today?
Can you hear me all right?
Yep.
Cool. So 2 questions. The first is actually related to Hidalgo. I had put in a request on Monday to find out if there was a cause associated with the new 17 cases, and was told epidemiologists were looking into it, and I never heard anything after that, which I'm not complaining about that much. But it made me wonder about going forward in terms of, now that there's a heightened contact tracing effort, do you envision that you could make public when there are either specific events or specific places beyond congregate settings that are the cause of outbreaks, so that that information is, I guess, more publicly understood without violating, individuals, obviously health information. And my second question, which is sort of related, I attended a webinar on geospatial needs for pandemic resilience earlier in the week, and they talked a lot about diffusion as something that'll really need to be worked into the models going forward, probably a little more relevant in places with public transportation, but not irrelevant, and somewhat related to Matt's question and the questions I think we're all getting about, are the cases coming across borders, and once people are flying more. And I'm just wondering, looking ahead, what you think that might look like here in terms of tracking those kinds of issues.
Yeah, on the first question, I think you kind of answered it already. There's always this delicate balance between, well, there's time. So when we get a case report on 17 new cases in Hidalgo County, we won't have any idea at all for, as you saw, 22 to 26 hours, what happened with those cases, and then they have to connect that data together. There are confidentiality concerns, of course, but yeah, I think that, and I actually put out an email yesterday for stories about, things that happen to people who do social distancing and wear masks, and things that happen to people who don't. And I was just inundated by articles and around the country and some in New Mexico. But yeah, people really need to know that if you go to a baseball tournament in Arizona and you think you shouldn't wear a mask because you're exercising, you're gonna have a way 20 times the chance of getting COVID and bringing it back than if you never made that trip. And I made up the number 20, so a much higher chance, let's just say. And then there are these, it is tricky when you have 3 cases or 4 with confidentiality. And so there's always a balance. Like I'm in daily, multiple times a day communication with epidemiology, Dr. Smelzer, who's really doing a great job, Dr. Landon, who's doing a great job and has done so for many years and is retiring soon. Another great personal interest story there. And, they don't tell me everything either, which is good because we're trying to communicate to you where we can, but there's always going to be a delay. And another compliment I could take about what you just asked was that we're really doing a good job getting those reports on the cases out right away, which I believe we are. The follow-up information about what caused them or what they all have in common, that takes 3 to 5 days most often to really nail everything down. So, and of course, when we think it doesn't violate confidentiality and we can share it with you, we will. Second thing on diffusion is something we're already looking at. And Los Alamos National Labs, they're an amazing, we work with Sandy as well, but Los Alamos is doing a lot of modeling for the CDC as well. They've worked, the modeling we're doing with them about schools, they'll present this almost impossible to understand graph with 16 different scenarios for school reopening, but they have diffusion built into that model. And of course, a diffusion is something that could happen in a school where there's this spread beyond normal family units or across, as you pointed out, state boundaries. That article from the Journal of American Medical Association in Illinois and Iowa is all about that as well, is that obviously people aren't staying, on one side of every border. Their day-to-day life demands that they move from county to county or city to city or state to state. So we're tracking that, and we're working closely with Los Alamos to see what new insights they bring to that discussion.
Thank you very much, Dr. Scrase. Is this like a farewell? Are we not going to have weekly reports anymore?
No, I think the governor has, she has other things to do than COVID. I don't know if it was last week that she had her own press conference on another topic and on racial injustice, and she's in the middle of the legislative session today. So we want to make sure you all get all the data you need. But she's I'm sure we'll continue some regular set of contacts with all of you. Trip, Stelnecki would probably be the right person to ask that question, but I haven't heard anything to the contrary.
Okay, thanks, David. I'm going to now turn over to Gabrielle Burkhart, followed by Chris McKee. So Gabrielle, in just a moment, you should be able to ask your question.
Hey, can you hear me?
All right, Dr. Scrase, can you hear me?
Yeah, hi, Gabrielle.
Hi, nice to see you again. Thanks for doing these. So I have 2 kind of questions for you. The first is, again, kind of based on the national discussion, and I know there's been some controversy about this, saying a lot of this data may be politically driven, on how states and whether states are on the same page regarding the reporting of COVID-related deaths. I've seen some places out of Denver say they've now changed how they're reporting that if somebody dies of coronavirus versus somebody dying with it in their system. So I wanted to ask you, how New Mexico does that reporting, and if you, as a health official who pays attention to what's happening on, around the globe and the nation, whether or not you believe that the data could be potentially inflated or underreported. So that's kind of the first question. Second question is again about maybe towards the governor because it's about policy, but some people are organizing events where they're inviting the public, but saying, we'll require masks, we'll do social distancing, although it appears to still violate the public health order. So I don't know if you can address that at all with the public who might think, well, they're allowing these protests, but why can't we have a birthday party or, go to a racetrack and social distance and wear a mask, that kind of thing?
Yeah, those are both great questions, Gabrielle. So thanks for those. On deaths from COVID, we really rely very heavily on treating physicians for that information. So there's no, when death certificates are submitted, they have the cause of death. And then they may have, other contributing factors. In the top part, there's a little bottom part, and I filled these out, so I'm real familiar with them. But I'm not aware of any political nuancing at all with reporting of COVID deaths. I do know that sometimes the treating physicians won't know, and those go to the office of the medical examiner. If an investigation is performed there, there's a delay. So there could be a lag in data about cause of death. The other thing I'd say as a geriatrician is, deaths in people over, let's just say, to take a really small group, all the deaths in people over 90 that are attributed to COVID, I think that's a probably pretty reliable indicator. If you live to be 90, you're doing something right. But we know that the mortality rate is very, very high in people over 90 with COVID. It can be higher than 40%. The other thing is there was a study in New York City where they looked at total deaths and excess deaths, and there, surprisingly, exactly 75% of the deaths that had occurred in February, March compared to last year, February, March, were related to COVID. And so, so if there is some, political manipulation of the data, which I'm confident there is not in New Mexico, but if there was, it wouldn't be it couldn't possibly be more than 25%, I don't think. And, and lastly, as a physician who has to fill out those death certificates, it's not easy. Like a lot of the times, and I take care of people over 75, a lot of the times picking that first reason can be tough because there's 2 or 3 things going on. So, I guess what I'd say in the end is I don't think there's a political motivation, at least in our data. Second, if there is some over-reporting by physicians, I would guess it would be internally balanced out by maybe another physician perspective saying, well, I'm just going to say it's Alzheimer's and write COVID in the box below. So anyway, that's that question. And then the second question is, what about these gatherings? So the gathering limit size in New Mexico with the stay-at-home order is 5. You and some people even read it to say it's 4, but you and 4 other people. And so in general, those kind of bigger gatherings are the ones where spread occurs because there are more people there, you have more chance of getting the virus. So that's why we're still on a stay-at-home order and why the gathering size is 5. I'm in a men's book group. There are 10 of us. And we thought, well, maybe criteria will relax a little bit in June. We met last night. And originally we were going to have 2 groups of 5, one in Albuquerque and one in Placitas, because that is about how our membership works out. And in the end, I think really everybody in the group said, let's just be safe. Let's just call in on our televideo conferencing system. Everybody used their own computer, and we did. And so I would say, you know, to New Mexico, just go to as many birthday parties as you want with as many people as you want. But if you're going to go to one with more than 5 people, have it be on your computer and not in person.
Thanks, David. Chris McKee with KRQE. I'm going to unmute you so you can ask your question, David.
All right.
Good.
Thank you so much.
Chris,
Can you hear me now?
Yes, I can.
Awesome. Okay, thanks. I just had 2 questions. One was about the Albuquerque Zoo. It is the most popular tourist attraction in the state, so that obviously says something about the amount of people that go there, right, when we keep COVID in consideration. But some are going to argue, of course, hey, it's mostly outdoors, and we're seeing a lot more sort of flexibility with outdoor stuff. What are the key concerns that perhaps you can shed some light on when it comes to the reopening of zoos? Because I think now we go back before the health order, the city had really intended and hoped, I think, to reopen the zoo in early June, and then they kind of backed off from it per working it out with the state. So again, what are kind of the key concerns when it comes to like just reopening those outdoor areas of the zoo? And I'm thinking of Albuquerque, of course, because it's the crown jewel, as mayors of the past have said. Second question, very quickly, on Dexamethasone, the steroid written about in the New York Times. Of course, this week, University of Oxford said they had a controlled study that showed that this sort of, as it was written, an inexpensive and commonly available drug reduced deaths in patients with severe COVID-19. Is the state doing anything with that? Obviously, it's not a study from here, but interesting research.
Yeah, no, I'll deal with both of them. You know, I have a son who lives in Michigan, and he has a family, and I have 3 grandkids there, and they came and visited. We went to the Albuquerque Zoo. They're from the Detroit area, and they live in Ann Arbor, but Detroit is one of the largest zoos in the world, and they thought the Albuquerque Zoo is way, way better than the Detroit Zoo, particularly the proximity you could get to animals and the views that the grandkids could get. So I'm with you totally on that, how treasured a resource that is for our state and for the city. I think the way we look at that, I look at it, is that Johns Hopkins model that the governor keeps coming back to, the 3 different factors. Number 1 is how many people are we talking about, with more people being higher risk. So that, you know, with the zoo, unless you had some very careful metering or created zones or whatever, you're gonna have a lot of people in contact with each other. And then the second criteria is how intimate is that contact? And so how close are people together for how long? And, you know, that one might not be too bad of a criteria. Like if I'm leaning up against the railing of the penguin exhibit and there, you know, other strangers less than 6 feet away, but I'm only there for a minute, although the penguin is a bad example because everybody stays there for a half an hour just transfixed. But you know, how much time, how close? And on that, I'm going to sub-reference here. There is a recent study that came out where a hairdresser was, you know, it was a hair salon. I think it might have been in Missouri. I'm looking to see if I've got it on my little cheat sheet here. But they wear masks. All the customers wear masks. You know, it's not a lot of people, but you're in very close contact with a hairdresser, like very close for a prolonged period of time. But they wear masks, the customers wear masks, and none of the customers actually contracted COVID. So anyway, that's about the proximity and intensity. And then the third criteria is what can we do about the first 2 criteria? So, you know, I've been to some of those summer concerts at the zoo where you sit on the lawn and listen to the symphony or the band, whoever it's going to be. And that would be like a COVID spread nightmare, you know, blanket to blanket, people 2 feet away, drinking, singing along, exercising, even with masks. I probably won't go to one of those until we're vaccinated. So I think the answer is it depends as we open more and more, if people are more and more careful. Is there a shot at that? You know, I think there probably is, but I just don't know when. And then the other one was dexamethasone, common drug, very inexpensive. One trial early on, I think it was from China, I can't remember exactly, or Europe, early on showing that it didn't seem to work at all. Another one showing it might work. And then the most recent one is really about the use of dexamethasone in people with severe illness and something called cytokine storm, where they're really having this huge reaction that is likely going to kill them. And in those people, high dose intravenous dexamethasone does seem to work. So Matt is on that one. The clinical team is on that and reviewing that article. And I imagine we'll have some recommendations about it. But most clinicians are pretty attuned to anything new coming out. So I know in some of our ICUs, it's already being used for that particular subset of patients. It's not for every patient with COVID, but those ones with this very serious medical issue.
Interesting. Thank you. Very interesting.
Thanks, David. So those are all the questions we've received from the members of the media thus far. We've got a few minutes left. I'll keep checking the chat in the event that someone asks a question.
Okay, just two more quick things then. One is just to acknowledge you, Alex, for Alex prepares me like 80 slides almost every day, and then we just cut out the stuff that we don't think would be that useful or helpful to go into detail on. And as a great moderator as well. So thank you for that, Alex. I think the other thing is please let your readers know that these curves are not about the virus, they're about us, and they're about social distancing. And that if we do want to continue to be able to do more of the things we used to do and between now and when we're vaccinated, it's absolutely essential that we wear masks, that we keep that distance, we wash our hands, we do those things that are necessary, and that we, to each take on an individual responsibility for protecting other people in the event that we're one of those 24% of people in New Mexico who have COVID without any symptoms, because that's a really, really big number when you're talking about a pandemic. One last thing I just remembered about the question, the last question also raised the issue of inside and outside. And there's this very widespread belief that's really bolstered by expert opinion that outside is probably better than inside. And, I respect experts and I'm glad that they have opinions and they're willing to share them. The only article about this that's relevant is that COVID on a surface in sunlight is usually inactivated in 1 minute, but there's no actual great evidence. And the other thing about inside is that if you're having recirculating air, there's evidence that that could be a problem. But I'm still pretty agnostic about whether outside is really safer than inside. I like being outside more than inside, and I really enjoy the beautiful New Mexico surroundings and the mountains and the hiking. But I am not a believer that there's sufficient evidence that would be reassuring that outside is generally better or more safe than inside. Now, in saying that, I'm just another expert with an opinion about it. And so I'm not giving that any more weight at all than others. Maybe I have less expertise than some of the brilliant people who have put this forth. But again, let's stay with evidence. Let's really rely on evidence. And if you can educate your readers that we still don't really know for sure that just being outside confers more protection than inside, that would be helpful to us as well. Anything else there, Alex? Any last questions?
We do have one more question from Gabrielle Burghardt, who relayed that I could just ask you. She said, do you know if the state does any postmortem tests for COVID-19? Like, for example, an unintended death or someone who died before a lab test was possible. Is there a chance to test for COVID after someone dies?
Yes. And the OMI, I mean, if your death was due to a motor vehicle accident or homicide, probably not a high probability you would get a COVID test. On the other hand, if you if there's any report of symptoms beforehand, or it was a totally unexplained cause of death, then I know that the OME is looking at those cases and doing that testing as it's indicated. So the answer is yes. Not only a possibility, but particularly in an unexplained situation, or anybody who is in a more high risk category, I know that they're doing that testing. All right, well, thank you, everybody. I really appreciate the dedication you all have, your attention to detail, your willingness to continue to educate the public. I think if there was one thing that would make the biggest difference, it's really the education of the public about what the virus is doing and what we all need to do to combat it until we're vaccinated. And so I appreciate your tireless efforts to continue to reinforce that education, because as you know, we don't all learn just from reading something once. We need, or seeing it once. We need to keep learning and keep learning. And the more that gets reinforced, and the more people go out into the world and see that everyone is wearing a mask, the more likely their beliefs are to be changed as well if they weren't inclined to do so. So thanks again, Alex, and look forward to doing this again. Take care.
Thank you, everyone. And a kind reminder that the recording for this webinar, as well as the presentation, will be shared with all of you through email shortly after, either today or tomorrow. Bye-bye.